o'clock. So what I'm going to do is I'm going to make a start on this session because, like I say, I'm conscious of time and don't want to keep people longer than we have to. So thank you for joining us today, and thank you for attending this event. So a few things that we're going to go through today. I've got a quick bit of housekeeping just at the top before we move on to the welcome. As I've mentioned, for those of you who were here a moment ago, the session is being recorded. So we will make this available afterwards, also to colleagues, and then we'll potentially look to use elements of today for the purposes of training and additional communications materials that we use. We have set up a Q&A as part of this event. So I've got the team here with me today from all different sort of areas of the project. So if you do have any questions, then please do feel free to ask those questions in the Q&A. And again, members of the team in their areas will come back to you. And then what we'll do at the end of the session is, time permitting, we'll potentially, if there's any questions that are of a common theme, we can address those sort of collectively. So today, the purpose of this event, like I say, it's to introduce the Northamptonshire Care Record to GP practices across the county. We've got Professor Chilton here to give us a welcome in just a moment. I'll be able to talk to you about the NCR and what it is and what it will mean for you. My colleague Steve is here, and he's our technical representative, and he will give you a walkthrough guide of the system itself. Claire has kindly volunteered to give us her thoughts because Claire has been using the system as part of our testing process. And then Ed is here, and he's going to go through the communications materials that are available to you as part of this project. So what I'm going to do, I'm going to hand over to Professor Chilton, who will provide the formal welcome.
Thank you so much, Katie. And, you know, today, we cross a Rubicon, we really do. Healthcare is going to change in our system, and so it augurs really well for us. And I was thinking about the fact that, you know, as a child in Africa, I was 6 years old, and my father called me to listen to the radio with him. And it was a long wave frequency, it was scratchy, it was difficult to hear. But what I recognized were the names of the astronauts, and it was the moon landing that was ongoing at that stage. And I thought, you know what, today is really our system's moon landing, because the technological revolution that came out of the moon landing was really incalculable. So we have our moon landing today, and it's been a true collaboration across all organizations within our system. And it's been underpinned and driven by mission, enthusiasm, and a desire just to make healthcare better. So I can't compliment the team more. And the gains from this will be many, but the measures I think about are about joined up care, accessible care, continuity of care. And this will ultimately translate into safer, better communicated and effective healthcare for all. And so I can't thank the team enough, and I'm sure their enthusiasm will infect you as you go through today. And I'm just sorry I can't be with you for the whole journey this afternoon, as I'm handling emergencies, and they're just wheeling one in right now. So enjoy, and I hope you find it informative, and thanks to all the team.
Thank you, and thank you for joining us this afternoon. I appreciate, as you say, your day is very busy, so your time is appreciated. Thank you very much.
No problem. Thanks a lot.
Take care. So if I move this on now, so I'm going to explain to you about the NCR. I'm very conscious that within the forum of this event, there's people I've already spoken to. There's some of you who NCR might be quite new. There's some of you who may have heard about NCR sort of over a longer period of time. But what I want to do is just give you a quick bit of history as to where, you know, why we're where we are and what it is that we're actually doing. So why Northamptonshire Care Record? Why a shared care record? The purpose of the project is to join up direct care across Northamptonshire, and I think it's very important, even at this very beginning, to reiterate that we are looking at direct care. We're looking at healthcare professional to healthcare professional. The Northamptonshire Care Record is not a system that patients can access. It is not a system that patients can read and write to. So I'm conscious there is other work going on out there at the moment with GP practices and patients having access to information. This project here, this system that we are providing is, as I say, it's more internal. It's, as I say, professional to professional. But what we're doing is we're looking to join up this direct care. We're looking to improve patient care by putting together a system that brings together data from a number of sources within the county. So assisting patients in their journey, assisting you as healthcare professionals to make sure that we're providing the best experience for everybody involved in that process, as I say, whether it's a patient or whether it's yourselves. So what actually is that? That is a shared care record, and that is the NCR. So I talk about data now. Obviously, data has a quite wide-reaching connotations here, but in terms of the context of the Northamptonshire Care Record, we're bringing together data from a number of different sources. You'll see there in green, we've got data coming in from the acutes, we've got data from community and mental health, and then we've got data coming in from GP practices using System 1 and EMIS. What again, it is key to point out in this context is that it is a range of data from these providers. Here and now, it's not all data. It is what at the moment we are able to provide, and again the demonstration will sort of highlight that bit more. But it is bringing together more information than in effect you currently can see. So you will be able to see acute activity, you'll be able to see community activity, and likewise in an emergency scenario, people working within the acutes can also look back at GP information. And again, this just helps to provide that rounded view of a patient, that the patient is being treated appropriately and that the most appropriate care is given, because you are able to make informed decisions on that patient with the data that is available to you. There's a few technical things here that I'm sure Steve will cover about sort of the data and how often it's refreshed and how visible that data is to you. But again, it's just pointing out that the data that's coming in at the moment is, like I say, a range of data from sources. We are working to ever increase that pool of data for you, of course, because that is that is key. So you'll see on the right hand side the amber circles that we've got there. That's showing you at the moment what we're working on as sort of already, even though we're launching this today, we are already in the next phases of development. We've been attending workshops regarding end of life care. We're talking to the ambulance service. We're talking about bringing in additional data sets from the acutes in terms of results. As part of this onboarding process, there is a user guide that's available. Again, that has gone out in the communications. It's attached to this event within the documentation. The appendix at the end of that actually does highlight what the data sets that are currently in the system are. So again, if you're unsure and you just want to see, oh, can I see this from KGH or NGH, that information is detailed within the user guide that is available to you. Just they're setting expectations. But this is a very collaborative process. We want to hear, if there is data that is incredibly valuable to you, we want to know what that data is. We want to understand the system and what you get from this information. So we are, as I say, always looking to develop and increase and improve the data that is available to you. So in terms of, I think, the why should I go into NCR? Why should I add this to my workflow? Why should I bring this into my day? There's two cases here on the screen, and I've split it quite simply into a patient and into a healthcare professional. So from a patient's point of view, and ultimately we are all patients at some point, you go into your appointment, and what we want to do is work so you only tell your story once, or as much, as little as possible in effect. So the time that you have spent with a healthcare professional is really valuable. So we want to make sure that you get the most of that time. So a patient is not, like I say, feeling like they have to tell that story more than once. They feel like they're getting a worthwhile experience, and they feel they're being listened to, and that the clinician or the person involved in their care has the information to hand to assist, with any issues that they may have. And then you then flip that round to, as a healthcare professional yourselves, again, you have the information for when your patient, or whoever you're working with is in front of you. You've got information, you've got that rounded view on them. What it's then doing is it does free up your time. You're all highly skilled professionals, and it's meaning that you're using your time to do what you're trained to do what you're good at, to do what you're best at. So it just means that, again, you've got a range of information rather than potentially looking at things in isolation. Going forward, as part of this process. As I say, it is collaborative. We want to work with you. So as we move on from today, we will start to talk to you about the benefits of the system. We will be reaching out to you to understand, you know, from today, how do you feel about the system? Do you feel it can benefit you? And I appreciate, you know, we'll obviously, as I say, go through a demo and we'll hear from Claire. But, you know, how do you perceive NCR? Do you think this is going to help you? Is this going to help you move forward? And we will look to get that information from you, and we will work to you know, hear from that and sort of do that research. And then further down the road, we'll come back to you and we'll say, okay, now you've been using it for a period of time, can you see these benefits that we've identified? It may be that you've seen you're having a benefit from the system that wasn't originally perceived, or, you know, things are unexpected, or again, working with us, we can potentially bring stuff on board that can help you achieve goals, and, you know, whether it's efficiencies or savings for you within your practice. Just anecdotally, there is a case study listed within this slide, and if you do get some time, I would strongly recommend it as a watch. I think it can demonstrate the benefits of a shared care record process probably better than any of us can in this room. It's a lived example from a lady whose son unfortunately passed away, and a lot of the outcome of that was because people didn't have the information to hand that could have potentially have changed the sort of the course. It's a very emotive piece, so it is definitely worth a watch. But that is available. I can obviously post the link out to that, but it's a very good example of why joining up patient records for the purposes of direct care really is key. And as I said, you know, it is an NHS objective as well, so we're working within sort of like the national sort of guidelines for us. I'm now going to hand over to my colleague Steve. Now, Steve is the technical lead for NCR. I know some of you may have already had contact with Steve as part of this process, whether it be regarding testing or whether it's about the setting up of your system. So Steve's going to cover off a few areas. The first one being the setup, because as part of having NCR, you do not have to have a separate login. It's not another system that you've got to go and access. The setup that you will do with Steve, in effect, will give you access via your System 1 or your EMIS system through the click of a button. And Steve will show you how to, you know, how that works, potentially on a one-to-one basis with you if you need any help with the setup. But from there, when you are set up, you can access your patient record. Steve will talk about the user guide that we've got available to you, and he's going to provide a demo. And I will just point out, as I say there, that the demo is a test environment. It is not live patient information, so we are perfectly secure in that sense, so we're not sharing anything that we shouldn't be. But Steve, if I can hand over to yourself.
Yep, absolutely. Hello everyone. As Katie just said, some of you have already met me, and a huge amount of thanks to those GP practices that have been helping us along this journey. It has been quite arduous at times, and I owe a lot of you some beers all round. So thank you very much for all your assistance on that. Obviously, you know who you are, the various practices who've been helping with the testing. As Katie said, the setup itself is included in the user guides, which have been all sent out to you during communications. Some of you might not have that yet. That's not a problem. We can always resend them out as we go along. If you don't have that, then just let us know and we'll get onto that straight away. The guides have proven very successful so far. We've got quite a few practices that have already set themselves up successfully, and we hope that this rollout will continue as we go. I know a lot of practices were obviously waiting for this particular introduction before moving ahead with that, and that's absolutely fine. When you get to it and the guide is there, it's a very easy step-by-step to follow-up guide for both TPP and EMIS. There's two separate guides, obviously, for two different systems. And when you get to the username and password, I'll send that out myself. As soon as you give me a secure email address, I can then send it on to you in a secure format so that you can all then add yourselves as you go. Once you've set yourselves up, obviously, EMIS is almost automatic. It's available as soon as it's been done. TPP is slightly different. It has to be published before the group can use it. And I can go through those steps with you separately if you need to. Obviously, I won't go through that all here because this is a demonstration more than anything else. But the overarching excuse me, picture is, if you have any issue, just drop me a mail and I will get onto it as soon as possible. So the demonstration I'm going to show you, as Katie said, is a test patient that was added for us by GraphNet. They've tried to emulate the data that we've got as clear as possible. to make it as similar as possible so that you can see roughly what you're going to see for any kind of live patient that you have. The main difference, obviously, between the acutes and the GPs is the way that you access it. This is either done by a button on TPP, which is a little teal button, as you'll see when you get to that stage. And in EMIS, it's at the side. Rather than go through those immediate details, I can go over them later with you if you need extra help setting it up. That's, as I said earlier, not a problem. So when you get to your button or your side slide, you'll see that you will land on this page. This page is a context link page. So obviously, whatever patient you're looking at that time, it will then be shown to you in this format. So it comes up with this home page, as we call it. It's extremely straightforward and very easy to follow. Your top buttons up here along the top won't be the same as this, because this is a demonstration system. It shows you everything that we've got, including the things that we're testing currently. So don't be surprised when you only see 4 or 5 of these buttons rather than all of them. They are generally the most prudent ones for the use for everyday use, should we say. So activities, GP information, etc. So that will look slightly different. As you can see, we've got the red banner, which gives you an immediate sign as to what you need to know. Occasionally, this banner will change as we go along. It's a growing system, so those things may change. It's just a warning to tell you exactly what we've got and where it's coming from. In the cases of the acutes, they are fed by what's called the HL7 feed, which is basically an automatic feed. As soon as somebody enters data, it goes straight across. It's a messaging service that is already in place. The 2 GP sets, TPP and EMIS, not quite the same. They use a file that is sent overnight. So it's a 24-hour window between getting that data. And that's the same for NHFT as well. As you can see, the summary page, the home page, tells you pretty much everything you're going to need to know, but it's in summary format. So it'll only show you a couple of lines of each particular category. In the very top banner, you've got a drop-down menu, which will show you the most recent data that they have on that patient's contact details, phone numbers, home address, and GP. Obviously, for the purpose of the demonstration, it's not all filled in. Most of it will be, but in a live patient, obviously, that will tell you everything that they've got. So anything that's sent across will appear in there. It's a summary, if you like. Further down the page, you'll see that it will give you a rough idea of how much this patient's journey has taken them. It will show you where they've been. For example, record content will demonstrate that this patient has identifiers in the hospitals and in GPs. So they've obviously been around, meaning that the record is going to be quite full. Then you've obviously got allergies, and then it goes on and on for the various headliners, shall we say, of that particular patient's journey. For the sake of the GPs, obviously, you've got your own systems. You've got TPP, you've got EMIS, so you might not necessarily need the GP information panel, but in there is everything that is sent to us via TPP and EMIS. So everything that is sent to us is recorded here. Now, in most of these cases, things like medications, problems, etc., will be into the thousands in some cases for patients who've obviously got long-term conditions. And it will only show you the summary. If you need extra information, you just click on the header and it will bring up the information that it has stored. It always does it in date order from top to bottom, but you can change that using the filter system and change it to the oldest or the newest, etc. Special conditions will obviously come up as marked as red in this case if it's out of the ordinary. So they have obviously statistics that they use, and it will highlight things that are problematic. Most of these categories, I say, you will have access to in your own systems anyway. So you're probably more interested in what the hospital has to say. So the hospital activity page panel will show you everything that the patient has had in their journey through a hospital. So it will show where they've been, who they've seen, what sort of attendance they've had, whether or not they've rejected or not turned up to an attendance, etc. All that information will be pointed out in here. Now, the acutes don't send exactly the same data, so it might be different depending on which hospital they visited, but the overall, it will look very similar to this. So you'll be able to see, for example, that they've been discharged from general surgery and gives you a rough idea of where they've been. Other features that you'll see that might come in very handy, medication, for example. Most of those feeds are coming from the GPs themselves, but it will give you an idea of what that patient has had or will be having over the course of their treatment. As you can see, navigating it is very easy. You just literally go across and it will show you everything that you might need to know, and you just click on the relevant banner to show you what you need to see. So as it goes for setup, that is the starting point, if you like. And as Katie's already said, this is the very start of the journey. I know it has taken some time. I know some of you are aware that NCR has obviously been on the cards for some time, but this is it. This is the launch. So this is our starting point, and from here we'll only get richer and richer data as we go along. Any problems you have with the setup or anything you have technical questions, please just get in touch with me and I will help as much as I possibly can. If there are any areas on here that you'd like to see in closer detail, obviously I can go over more details. Just pop it in the questions and we can go back to it. That's not an issue. But overall, that is the starting point, if you like. That is what you will see when you go into your system, and hopefully it's pretty self-explanatory. Are there any immediate questions for that? Silence is golden.
I think, Steve, it's also worth mentioning at this point as well that the access to NCR is, if we could just talk about the access and the fact that how it's controlled, in the sense that there are roles and permissions that are available to users.
Absolutely.
So depending on your role within your practice will depend on the information you can see. I don't know if you want to cover that, Steve.
Absolutely. So at the top, you can see that I'm logged in to this system. And from that, it will tell you who you are, if you like. Now, in the case of the GPs, it will come up saying your GP's name. However, when you log on to EMIS or GPP, you use either smart card or password to get in, and that records who you are separately. And it will attach that to the access point, and it will know who you are and what access you should have. There are two levels of access that are generally used the most often, which is administrative and clerical, and then clinician. So those two will demonstrate slightly different pages. You'll have a few more boxes to access on the very top. You've got these tile access points, and it will show you a few more if your access level is slightly higher. As for the data you get, that is from a tenancy point of view. So obviously GPs have their own tenancies. They have their own patient cohorts. You automatically have access to those, plus the patient journey. If you have access to that patient, it will show you where that patient has been. So you will then have access to the various other sources that they've got. I hope that makes sense. But for the purposes of auditing, obviously it records who you are, so what practice you are, and then your secondary username, which is the TPP or EMIS username, which it then attaches to that. So everything is audited, literally everything. So any keystroke, anything you do in here, any search, anything like that, all come up, just for audit trail purposes. Naomi, got your hand up.
Yeah, thank you. It's really useful. I had a couple of questions. The demographics, when you click on the patient and the demographics comes up, where does it pull that from? Is that being pulled from GP data?
It pulls it from all of them. So the most recent one is the one that is shown. So the most recent information that's inputted will be the one that's at the top. However, all information is recorded from all sources. So it will store all of that information. But to stop confusion, obviously, it only shows you the top level. So the most recently added information. So if somebody attends a hospital visit, that will be the information that it shows if they've confirmed or reconfirmed their data.
Just sometimes people go to hospital, they don't go into hospital very often, and they have an old address or, you know, old name if they've got married or something on that data. So it's just, I guess, like I say, not confusing the issue. Actually could be really useful. I know that every time people go into a hospital setting, they should be checking the demographics. Yep. Will that be done through this?
It can be. So it will show if the data is different in the NCR. Obviously, we can then refer back to the source where it came from and advise them that their data might be slightly askewed. And that, like you say, that is most likely going to be the hospitals themselves. But it can be reported to the hospital, and then they can change their own systems. And as soon as they change it on that system, it will be updated on NCR, and therefore it will be the most up-to-date information.
Okay, thank you. And then the second question was, you talked about community, so NHFT, community and mental health. Is
Yep.
palliative care available? So like hospice data, because the hospice are on system 1 and the community palliative care nurses use system 1. Is that data available?
If the nurses have added into a system that we have access to, then yes. However, I don't believe that we have a direct link to the palliative care units yet. So in the case of NHFT, we take on board whatever information they send us. So if that patient has got palliative care information, it will come through in their in that panel, the one that's on the screen now. So it's not guaranteed, and it is something that we will look at getting as a separate data feed along the way, but it does rely on whoever sends us that data. So if the GP, for example, record data on that nature, that's what we'll receive and it will be shown. But if it's not, then we won't have it.
It'd be really helpful to have hospice data available, particularly for EMIS practices. So for System 1, it's less of an issue, but for EMIS practices, I would imagine it is a bigger issue. But also so that it works the other way, so that will the hospice have access to the NCR, because then they are able to see back things that have happened within general practice, albeit a small amount of data at the moment, but over time, because that again would be really helpful, particularly as we move towards more of that end of life care planning, just to make sure that we've got information around that patient from all data sources, not just general practice in the hospital, but the hospice can often be a really important source of data.
This is the sort of thing that we need. Obviously, the more information we get from these sources, we can go out and reach out to them and try and get them onboarded. We've already had a few suggestions from the GP world about the PCN groups to try and bring them on board. And the more that we know about it, the more we can spread it around, as it were. I noticed Thomas got his hand up. He probably can respond to that better than me.
Well, I can confirm that it will have hospice data because, as you say, the hospices are under NHFT and they use our NHFT System 1, so that will be an NCR. And the hospices will have access to NCR in about 3 or 4 weeks when we push it out to all of NHFT.
Amazing. Thank you, Thomas.
I can see another hand, I believe. Is it Holly Jo? Hiya.
Hi, it's Holly Jo and Sam from Daintree Medical Practice. Good afternoon. My question may well be incredibly oversimplified, but I'm going to ask it anyway. A lot of the documentation from particularly secondary care, we already receive in as an electronic upload effectively. Is the plan for NCR to overtake that? So you won't have that, you won't have the duplication. So eventually we will be able to see anything and everything that happens from Northampton General, whether it be a consultant, whether it be a specialist, whether it be A&E, etc. Is that the plan, or will we have both effectively?
So the ongoing scheme is to get as much data as we can get our hands on realistically. Documents are a part of that. So letters and documents that are currently stored in places like Mediview within NGH are already on our roadmap to look at, to try to get those feeds in. So overall, yes, the plan is to get as much documentation as humanly possible. However, we can't give a timescale about that at this point, because obviously we need to work out all of the nooks and crannies and niggles that might come about from trying to get that data in. But that is the overall plan. That is what we intend to do, yes.
Okay, great, thank you.
No worries. So I don't see any more hands up. So obviously, as I've shown, the navigation from tile to tile is very straightforward. Any data that we get basically is going to be shown there. And it all comes down to the exact same banner, which is basically check with the patient. If you're not 100% sure, it's always the best way. However, we are trying to start a journey into getting all of the data in one place at one time. And this is what we're starting with. So if there's no more questions, I'll stop sharing and hand back over to Katie. Thank you.
Brilliant. Thank you, Steve. I think that was really interesting and useful. Holly Jo, I can still see your hands up. Is that a Lexi hand, or have you got another point for us before we move on?
No, I think that's technical error.
Not a problem at all. Didn't want to miss you in case you wanted to come back in. But thank you. Yeah. Thank you. So what I'm going to do now is I'm going to actually bring Claire into this event. And Claire is one of the people that Steve was calling out, basically, who's been helping us in this process with regard to testing, because obviously there's a lot of testing to do with the GP data. But what it meant was we actually utilised Claire and colleagues at Albany House Medical Centre to help with the testing, and also to start using NCR before, obviously, you know, it was out there in the wider world, but just to start looking at NCR sort of in parallel to day-to-day practice and just seeing where, oh, okay, I could use NCR for this, and oh, if I looked over here, this will give me additional information. So Claire, I've got a couple of questions for you, if that's okay, but if you just want to talk to us about your experience. I mean, the first thing I want to ask is right at the very beginning of this is kind of going right back to this, you know, Steve's first points about actually accessing NCR in itself and utilising, you know, going from your patient into the care record. What's your experience of actually getting to the information and getting round the information, I suppose?
I mean, even in the beginning, it was really easy. I got shown how to access it, and within not even 2 minutes, I was like, okay, I'll have a play with that. It's really easy through System 1. It's just a link. You can put it anywhere on the toolbar, so there's nowhere in particular it needs to sit. When you access it, so obviously you need the patient open that you want to access it for, so it picks up that particular information. It will open on the screen, all of the tabs, everything you just click on, it opens the information. Just really easy. I didn't really have to get taught how to use it, really. It's quite self-explanatory. The information is there. You can see what you're looking at. Click on things and it opens more. I've been using it obviously now for a few months, and I don't want to be without it. I don't say that I use it daily, kind of thing for every single thing I'm doing, but there's always seems to be that time where, let's have a look and see if it's on NCR, see if there's any information that's going to help me at this particular time. And in the beginning, I thought, okay, let's see how this goes. How much am I really going to use it? And as time's gone on, I mean, I can't even count how many times it's helped me now, because it just feels like everything I do, it has an impact.
Brilliant. Well, that's really good to hear, and I think it's really good as well. And I've got colleagues on the call from GraphNet as well who are actually the provider of this platform, and I think it's really good to hear that the system is intuitive to use. You know, you feel like you can just go in and instantly find that information, because I'm very aware that, you know, everybody has a lot of systems to use, and learning a new system can be quite daunting, can't it?
Yeah.
So just to have the ability to just to, like you say, at your fingertips find that information, I think that's really good to hear. I mean, you talk about the impact on your role. What sort of impact are you seeing? Is it saving time? Is it the depth of the information? What sort of impact are we looking at?
If there's anybody else out there that are secretaries, I know sometimes you find it really hard to know who to actually direct the information to. Who do you need to contact? What secretary, what consultant are they under? It's not always clear from System 1. It depends if it's their first appointment, if they were referred from elsewhere, and you need to find out exactly who are they under and who am I best to contact. So using the NCR, most 9 times out of 10, I've been able to pinpoint an exact consultant, which it does save time, because you haven't then got to phone a department and ask, I don't know who this patient's under, I don't know who's best to talk to, and you end up getting past obviously pillar to post to try and get to the right person, and they might not be there. So again, it's finding that information quickly. It saves the time, it speeds up just generally patient care as well. So you're being more efficient and you're being able to deal with it there and then, and not having to wait for anybody to get back to you just to find out who you need to talk to. So you can go straight to them. It just has made such a difference to my workload, just generally the stress of having to call around and find people or send emails, and who's best to contact for this, who are they under, is it Kettering, is it Northampton, is it, if it's not on there, okay, it's probably another hospital. With obviously the information that's on there at the moment, it does speed things up. And I don't know how many times I could say I don't want to be without it anymore. And I think I said to Steve, please don't take it away from us, because you don't need it for every single thing you're doing, but it does make that difference hugely.
I think that's key, isn't it? It's about empowering you within your role to have information at your fingertips, like you say, to, you know, whether you are, and again, we all know we're busy, we know the environment we work in, so to be able to potentially not make a phone call, and, you know, obviously it's the nature of my role, I will always look at benefits and, you know, tangible benefits, and, you know, but you're not spending time on a phone call, you're not spending money on a phone call, you know, and then if the person you're trying to get hold of isn't there, they're on leave, you're waiting for them to phone you back. Just having that immediacy of the information, you know, I think is really key. And again, it's why we're looking to do this. And I think, again, just picking up on things that you're saying with, I don't want to say the limited data that is in there, with the starting point of data, because, you know, as we say, we are looking to grow this. Just with what you've seen already, the information that is there is helping you. Also, you know, thinking about this, you know, the experience that you've had with your role, can you see, identify potentially sort of the impact that it may make on the practice as a whole, rather than just, you know, an individual role? Can you talk to us about that a little bit?
I mean, everything now these days tends to be care navigation and making sure people get to the right place at the right time. So with this NCR as well, it can help even receptionists. So when you've got a patient, before, they may not need to speak to a GP to be able to find out, have they got an appointment, or discuss a referral that may already be in place. So that sort of first point of contact and being able to assist the person straight away with that extra information, it's invaluable. Do you know what I mean? It really, really helps. And you, even if you somebody was in with a GP at the time, the GP would have that information there. I've had people that believe that they're under a particular type of consultant and they're waiting for referrals, but actually you look at the NCR and they're under somebody else. They've already got an appointment that they're not aware of, and you can actually speed that information getting back to the patient and actually making sure that they're aware of what's what. And it does make you feel like the NHS is being linked properly and that care is being brought together.
I think it's quite a sort of a perception, isn't it, you know, by the public, that people do have access to information, and they almost get a little bit surprised when they realise that you don't have things at your fingertips. So again, that's really key, is that we can, you know, and I'm conscious we talk about speeding up processes. It's not speeding processes up to hurry the process, it's speeding up processes to allow for greater time and depth to be working on what it is that's key for you to be working on in the role that, you know, whatever role it is within the practice.
It's just efficiency and patient care and just everything working together to make sure as well that everybody does have all the relevant information for that particular person. I just think that's so important for any individual, to make sure that everybody does, that needs to know, have that information that is important to them and can provide better care.
Brilliant. I think, Claire, brilliant. Thank you. I think that's been really helpful, and it's great to actually, you know, I'm conscious when we have these sorts of forums, you know, that we're obviously giving out a message, but it is great to have somebody like yourself who can give a lived experience of, you know, just in like you say, the short time that you have been using it as part of that testing process. But, you know, I can already see that you guys are flying with your usage. So yeah, great. Thank you very much. Thank you for your time. Really, really appreciate that. Thank you.
Thank you all.
So moving on to my next element, I'm going to bring Ed into the conversation. I'm just going to revisit my screen so you can see Ed's area of expertise, and we're going to be talking about communications material, because there's been a lot of work, a lot of good work going on within the communications team to ensure that you have what you need as part of this process, whether it's public or patient facing. But Ed, hand over to yourself and take us through it.
Thanks, Katie. Appreciate that. Okay, so yeah, I'm going to take you through a couple of slides which detail some of the materials that are available to you to understand and kind of share information about the Northamptonshire Care Record. So there's materials for both internal for within your practice use, and also a fair bit of public-facing material as well that you can use for patients. I think the main focus with the patients is that they don't actually have to do anything. This is a system that's in place. It's changing the way that they're their records are shared by organisations. So it's really just explaining what that process means for them, explaining that they don't have to do anything, and just it's that reassurance piece that that this is all happening. So all the information can be found on the web page that we've set up. So it sits behind the Integrated Care Northamptonshire website, but it's got its own URL there, which is connectingyourcare.net. You can see a screen grab there on the left. So there's a whole load of information for patients as FAQs there. There's FAQs for professionals as well. We've got a couple of hypothetical case studies in there as to how the system is likely to change the way people receive care. And importantly, there's also the downloadable resources there. So I'm going to run through in a moment the resources that we've got, but we will be sharing a comms pack to all practices, which has links to everything. It tells you exactly what there is in more detail. So you'll be getting a pack explaining that to you. We can move to the next one, please. Okay, so within the downloadable resources section of the web page, we've got a whole load of social media graphics with accompanying messaging, which you can use on your social media channels if you see fit. We've also created a template letter that you can use to send to patients if anyone is asking for further information. We have posters that you can display. We've got a couple of different leaflets. So we've got an A4 version that's easy to share digitally, and it's set up with large print, so it's easy for people to read. And then there's the professional kind of folded leaflet setup that we can produce for you if you require those. The leaflet is also translated into 11 languages, so that's the top 10 non-English languages in Northamptonshire as per the last census plus Ukrainian. And we've also had an easy read version of the leaflet produced as well. So all those are available to download on the web page. Skip to the next one, please, Katie. We've got a couple of screensavers as well, slightly different setups for System 1 and for EMIS, so you're free to download those and use those within your practice as you see fit. Blog posts, we're going to be updating a bit of a rolling schedule of updates on progress with the rollout of the Northamptonshire Care Record across the county and across all organisations over the coming months. So they will all be posted there on the website, connectingyourcare.net. And that's really it. So most of the materials, they're available for digital use and digital sharing. If you do have any print requirements, then please just let us know. And please do take a look at that web page and look out for the comms pack that we'll be sharing in due course.
Brilliant, thank you, Ed. And like I say, I reiterate the point, it's a very comprehensive pack that has been put together. You know, we're trying to make sure we can cover off as much as possible for you, for your use, for whatever purpose. But again, as Ed says, you know, just please do reach out if you have any specific requirements. So that takes me pretty much to the end of the agenda that we had set up for today. I'll just leave this on your screen for a couple of moments before I kind of come back just to faces. But this just gives you an indication of the, you know, just your key contacts for the project as it stands at the moment. But Matthew, I'm going to bring you in if that's okay. I know you've been keeping an eye on the chat, or if there's been any questions coming in, but as sort of digital lead for the ICS, didn't know if there's anything that you wanted to add as part of this.
Well, firstly, my role has been extremely easy because there hasn't been any questions in the chat. So I'm quite happy about that. But I just wanted to thank everybody for coming to this meeting. I know that it's very difficult to take time out of schedules when you're working in a GP practice. And I think particularly thank you to our speakers and to Claire for giving us such a fantastic summary of how it feels to use this system for the first time. If this is a moon landing, then Katie's our Neil Armstrong and Steve's our Buzz Aldrin. I mean, whichever way around you want to put it. But I'd like to thank you too as well for all the work you've done to bring this into life, and I'm very proud to be part of this. So thank you, everybody, and I hope you can use it and share with us what it feels like and what benefits you're getting from it over the next few months as you start to implement it. So thank you very much.
Brilliant. Thank you, Matthew. And I just to sort of end, really, just to say that, you know, I keep, you know, reiterating that we are working with you. You know, this is very much a process that we're doing together. Myself and Steve, we're absolutely available. We are happy to pretty much do whatever. If it means, you know, if you want training, if you want online training, if you want us to come and see you at your practice to get you guys set up and onboarded, to perhaps chat to your teams, we are more than happy to do whatever in effect we need to do to get you guys onboarded and, you know, using this system efficiently. So anything that you need from us as a team, as a project team, please do reach out. Please do say, we'd love to hear from you. You know, I know that always sounds a bit cliche, doesn't it? But, you know, we, as Matthew says, we do want to hear from you. We do want to hear how you're using the system. We want to hear how we can take it forward going further. As I say, I've got colleagues here, you know, from GraphNet as well, who are, you know, very keen to understand what users want, because again, you can put a system out there, but we need to hear from you as to where sort of like, you know, the key elements are. So again, thank you for your time. Thank you for joining us. Thank you for you know, being on board with this. And again, we will reach out to you and get you guys online. But thank you so much for your time. Thank you all.
Thank you. That's great.
One sec, sorry, before you go, I was just going to grab those questions out of the chats that have just popped in. Literally just popped in. Obviously, first to Catherine, I can tell you that easily. Basically, you just need to go to the URL settings that we worked on originally. I can do this with you, it's not a problem. And you need to publish it locally, and then it's done. And that's all there is to it. It's a simple case of clicking on the URL, going to publish, and making sure you click on local and not global, because that wouldn't work. But yeah, if you just basically go to the URL settings that we did. I know it was a long time ago, but I'm more than happy to jump on with you and sort that out for you. That's not a problem. The second one is, yes, if a patient's appointment details have been added to the hospital systems, then it is added to our systems as well. So any future appointments will pop into that activity section, as I showed.
Brilliant, Steve. Thank you for.
Sorry about that. Yeah, the glitch just popped in.
No, it's spot on. Brilliant. Yeah, great to cover those off. But yeah, thank you. So I will say again, thank you very much for your time, and we'll see you all soon. Take care.
Thanks, Katie.
Thank you. Thank you.
Thank
Thanks
you.
very much.
Thank you.
Bye.
Cheers.
Bye.